Cancer, the official podcast of the UC Davis Comprehensive Cancer Center. Thanks for joining us today as we have in-depth discussions of the science, research, and advancements taking place at our National Cancer Institute designated Comprehensive Cancer Center. We will also examine proactive approaches to cancer prevention and, most importantly, how we're breaking barriers to beat cancer in our community and beyond. I'm Chris Joyce, and joining us today is Reese Olander, Managing Executive Director of Development for the UC Davis Comprehensive Cancer Center. Thanks for joining us today, Reese.
Thanks very much for having me, Chris. I appreciate being here.
Absolutely. Well, today we're going to talk about what development is and the roles that it plays within cancer care, because I don't think people necessarily even put a definition to what development is, because we're not building something necessarily. And then as you and I have had conversations off air, I have learned a lot about the different roles that all this plays in the cancer care for our patients. So just to start us off, what exactly is development?
Yeah, so as you referenced, development has a couple different modern definitions in today's culture, but for our purposes, we're looking at philanthropy. Development is the development of donors, the development of support, and the development of programs within the nonprofit world. And so philanthropy, healthcare philanthropy, especially here at UC Davis Health and UC Davis Comprehensive Cancer Center, is incredibly important. It makes a huge difference in our healing mission, our ability to provide cutting-edge care, cutting-edge research, and cutting-edge community outreach and education. So for us, we look at development as pretty broad-ranging. It encompasses the entirety of the health campus, all the various centers that we have, obviously all across the education sector as well on the UC Davis main campus in Davis, California. And it's a key tool in our ability to continue to grow what we're able to do here in the Sacramento and Northern California region. And when we think of philanthropy and fundraising, we talk about that in a couple different areas. The first is current use funding, where we see funds being put into action immediately. Give a gift, and that gift goes into a fund that is important to you, that's impacting an area that's important to you, and you see that those monies operationalized relatively quickly. We also have a lot of endowment support. That's very important to academic medical centers and nonprofits in general. But for us, we look at that as gifts going into an endowed fund, a savings fund, an invested fund, where the principal remains untouched and just the interest that's generated from that investment, that endowed fund, is utilized for program enhancement, research enhancement, care enhancement down the line. The nice thing about that is that exists in perpetuity. UC Davis has a good size endowment base now with endowed funds across all of our campuses. And the Cancer Center has a number of those as well. And those have been instrumental in providing secure, predictable funding that we can rely on year over year. The nonprofit sector and funding is always in flux. I think this year is no exception to that, as many listeners will be aware of. So endowed funds are one tool in our philanthropic toolbox that we can use to provide some comfort and stability to the areas that are supported by those funds. Current use funds are incredibly important. That's where most of our donors direct their giving, and those areas of support are incredibly far-reaching. We have specific researchers and research priorities that are funded through current use funds. We have pieces of equipment that are funded through current use funds, and we have programs that are funded through current use funds. One of the things I always talk about with philanthropy, especially in healthcare philanthropy, is that any gift makes a difference. And those current use funds are the perfect example of this, where if a donor is coming to us and giving $10, that $10 is going to impact a patient's life here at UC Davis. comprehensive cancer center. If that patient or donor is coming to us and giving $10,000, that's going to impact a lot more patients. If you're coming to us and giving us $1 million, your impact is going to be that much greater. And so the gift size isn't as important to us as the impact of that gift and how much you want to partner with us on our healing mission. So, we talk a lot about supportive oncology services. When you come in as a patient, you are going to see your your oncologist, and whether they be a medical oncologist, radiation oncologist, surgical oncologist, etc. They're going to handle all of your clinical care, and as well as their support teams, the nurses, medical assistants, etc. However, we have a whole supportive oncology team, which is providing all the wraparound services. So most of us are lucky enough that we go through most of our lives without interacting with a hospital very much at all. You might come get your shots, maybe you have a minor surgery or something like that. You don't have to do very much with us. Cancer patients, their world changes when they get a cancer diagnosis. And all of a sudden you're spending a lot of time with the health system. And that brings about a whole bunch of unknowns. You are here so often being asked to engage with so many people so frequently that supportive oncology services provides areas to give you that guidance, pass through the health system as easily as possible. So whether that be patient navigation, whether that be massage therapy, or financial guidance, child life services for children or children of patients who are coming through for cancer care. Supportive oncology is huge. And that is an area where our current use funding really shines. We see gifts of any amount making incredible impacts on people's lives.
How do you mean? Like what? So you had mentioned like a gift of $10 is something that's useful. How does that play out in this?
As the cancer center that serves, frankly, a huge percentage of the state of California and going into Oregon and Nevada, our patients are coming from pretty far away. And some of those patients have real challenges with access to our cancer center. And finances is a big part of that. And so a $10 gift can purchase a gift card that can be given to a patient and their family. And that gift card can be used for gas or for groceries. And that little bit of savings for that patient and their family can be a night and day difference maker for them to get to the cancer center for their radiation or their chemotherapy or their surgery, or even transplants, for bone marrow transplants.
Sure.
Those kinds of things can make a huge difference. And so $10 can get a patient here on time for their appointment, where they might have had to delay that care because they couldn't line things up. And then, we look at supportive oncology services every year needs somewhere in the realm of $200,000 to $250,000. And thankfully, our community is able to support a good percentage of it, not all of it, but a good percentage of it. So that if you want to make an impact in somebody's cancer journey, supporting our supportive oncology team is going to be an immediate change in somebody's life.
So what happens to our treatment and the care abilities at the cancer center without these philanthropic gifts?
The UC Davis Comprehensive Cancer Center is an NCI designated comprehensive cancer center. That means that you can expect to come here and get top level cancer care. You're going to get some of the best cancer care available in the world right here in Northern California. That's always going to be true. What Philanthropy allows our physicians and care teams to do is push that care just a little bit higher. It gets them more access to clinical trials, gets them more access to research, it gets them more patients in the door through the supportive oncology team. It just is, it gives us a little bit more resources to push that care from what, maybe like 95% efficiency to 96 or 97%. And just that little bit of percentage increase enables us to treat more patients, treat them better, and put in front of them better cutting edge treatments that would not be available without philanthropic support.
What are some common misconceptions that you encounter or that you try and dispel? I guess, especially surrounding philanthropy, especially within cancer care and our cancer center.
I think the number one is that only rich people can give. I think that is the biggest misconception in philanthropy, especially in this country, is that only rich people can give. And that's not true at all. I think the vast, vast majority of the gifts that we receive every year are less than $1,000. They're in that $10 to $1,000 range. That's where the majority of our support every year is coming from. And sure, a handful of wealthier donors are supporting us. That makes a big impact. But what makes the largest impact is those smaller level gifts. And so I think anybody can partner with us to make a difference in oncology care here in Northern California. That's the biggest misconception. I think the other misconception is that people can only fund certain things at the cancer center. They can only fund research. They can only fund supportive oncology services, which I've been talking a lot about.
Mm-hmm.
We have so many different funds impacting every facet of cancer care across the UC Davis Health and UC Davis campuses, because our cancer research extends to both campuses in Sacramento and Davis. And so there's abilities to support cancer research in both areas.
Certainly.
We have physicians and faculty members and researchers who are looking at every type of almost every type of cancer that there is out there. We have some world recognized specialists in cancer that folks are coming from across the country to come see folks here that specialize in cancers that aren't treated anywhere else. And so we have support funds for those folks. UC Davis Health has a really robust School of Medicine and residencies and fellowship programs. And we have a lot of funds that are supported by our alumni to ensure that future students get the same, if not and better, educational experience. And so that we are continually training that next generation of top tier cancer researchers and physicians and medical teams. So you can support any area of the cancer center that's important to you. And I think that's the other thing, is that what I talk to donors about the most often is giving to something that matters to them. And that can be one of those specific funds for a certain type of breast cancer,
Mm-hmm.
a certain type of brain tumor, prostate cancer, supportive oncology, research or treatment. But it can also be to our general funds, which are managed by the cancer leadership team. And those are really impactful dynamic funds. As I referenced, and many of the listeners will be aware of, federal funding has changed quite a bit this calendar year in a way that it hasn't in recent memory. And one of the things that impacts the most is some of our younger, newer cancer physicians and researchers, folks who are just kind of getting started here. And what that unrestricted money enables our leadership team to do is support those younger researchers. One of the things that's incredibly impactful for those young researchers is to get philanthropic funding for some of their pilot research projects. And those are $25,000 to $100,000. A lot of that comes from our unrestricted funds as well as some other specific funds. But that gets those researchers working and going on their project where they wouldn't see funding otherwise. And so now they have a set of data and results that they can go out and pitch to larger funders. So whether that be the federal government, private foundations, or corporate interests, they have something that they only had because philanthropy stepped up, the community partners stepped up and supported them and got that going. And so that nowadays is hugely impactful for our younger folks. It also helps us, philanthropy also helps us with recruiting and retaining talent. We see that most evidence by endowments, where we have endowed positions. We can use that endowed position and the interest that comes with that as tools to recruit and retain the best possible cancer physicians in the country. And we've been able to do that numerous times with a number of the faculty members here. And a number of the folks that you've already had on this podcast are endowed position holders, whether those be professorships or chairs or fellowships.
Mm-hmm.
And those physicians and researchers have really, if you ask any one of them, they will talk to you about the impact that makes on their ability to perform cutting edge research right here in Sacramento, California.
Outstanding. So obviously financial gifts are probably the most prevalent type of gift that you get, but are other types of gifts accepted?
Absolutely. Yeah. Thanks for the question. Yeah, certainly more often than not, when somebody's giving us a gift, they're just giving us a check, or maybe they'll enter in their credit card on our website and make a gift that way. They might make a gift out of their retirement fund, their IRA. Many donors have required minimum distributions out of those retirement funds every year, and we have a whole slew of donors who direct all or part of those required minimum distributions to the Cancer Center. Those are some of the top ones. We also get a lot of stock gifts. You bought a stock 10, 15, 20 years ago, or even 5 years ago, and you don't really want to pay the taxes on it. You can use that as a giving vehicle. You send the stock directly to us. We sell it. You never have to pay taxes on that, and you get a write-off on the value of that stock. So it's hugely impactful for that. We also see gifts of real estate, whether that be a house or land. We see those. Again, you're avoiding capital gains taxes in many cases on those. And those come to us, and we sell that asset for you. So you can avoid that hassle too. You don't have to deal with a real estate agent and all that other stuff. We take that on for you. And then one of the biggest ways that we see really amazing change is through gifts through folks' wills, trusts, estates. And I think many of us, if you open up your bank account information, you look how much money is in your checking account and savings account, and then think about how much money is tied up in your house, your car, your other assets. There's not a lot of the cash versus your assets amount is pretty different.
Sure.
And so what folks are able to do by giving through a will or estate or trust is dramatically increase the impact of their giving. They're able to give larger gifts, and even if those gifts are coming 10, 20, 30, 40 years from now, we're able to celebrate you and thank you during your lifetime for that impact that's coming down the line. And I think that is in a way that, maybe you can only give a couple $100,000, a couple hundred or $1,000 now, but if by including us in your will or estate or trust, you can dramatically increase the amount of your giving. And we've seen some of those planned gifts, is what we call them, completely transform areas of our cancer center. The vast majority of the endowments that we have were funded through planned gifts. Some of the biggest research programs we operate are funded through planned gifts. And so those vehicles for giving really expand a donor's ability to make a change here at the Cancer Center. And it's very, there's a lot of different options within those. It's not just wills, trusts, or estates. There's a lot of other different giving vehicles there that can be significant tax advantage. If listeners have questions about that, please reach out to us. We have a whole team that's all they do is work on plan gifts, and they can tell you all the latest tax implications, all the different legal options for you.
Well, and it's exciting to think about too of how fast changes and discoveries come about, especially in our world today. And so knowing that a planned gift that may not come to fruition for 5 or 10 years is then benefiting from that advancement in knowledge and then hitting it at the right spot so that it explodes basically the research possibilities and the cure or the treatment opportunities there. So even though I may be giving it now or setting it aside now, the impact could be just off the charts huge.
Oh, yeah, I think that's a great way to phrase it, is like when those gifts arrive, all of a sudden the whole cancer center is able to just take this giant leap forward. Um, and I think, especially when those gifts, and we always encourage us for playing gifts, go into an endowment, um, the impact you're going to have is in perpetuity. For decades to come, your gift is going to be changing how we treat and research cancer
Oh, wow.
at UC Davis.
That's awesome. Well, you had mentioned you have like a whole team who deals with the legal, the tax, all of these things. Uh, where do people go just in general, just to even, how do I even learn about what, there's specific funds, there's the general fund, and then everything from there. Where do they go? How do they get in touch?
Our website, the Cancer Center's website, is a great place to start. There's a little giving tab up in the upper right corner. You can also go to give.ucdavis.edu and start there. Find out about some of the funds that are supporting. We also encourage you to talk to your care team. Talk to them about what they're working on, what their research is working on, some of the programs that they have operating in them. I think a great place to start your philanthropic journey with the Cancer Center is an area that is important to you, and often that's important to you because of your own patient journey or the patient journey of a friend or loved one. Those are great places to start. But certainly, our top priorities revolve around some of our primary disease states: lung, breast, genitourinary, OBGYN, cancers, head and neck cancers, liver cancers. Those are some of our top ones. Also, a lot of our community outreach and education work is very important. I think that's an area of the Cancer Center people often forget. They think about, oh, we're doing cancer care, we're doing cancer research. We're also doing a tremendous amount of education out in the community. And those efforts can be supported philanthropically as well. So I'm sure, hopefully most of your listeners by this time have heard of the Mammo Plus Bus. That's something that originated through a philanthropic gift that the Cancer Center was able to secure, and its continued operation is supported through philanthropic donations now. So when it goes to a community event or a school or any other item, more often than not, that day, 2-day, 3-day assignment is supported by donors. So that's an easy way for folks to get involved. Then, I think a lot of times trusting the cancer leadership to find out, especially nowadays, where a donor's dollar will go the furthest is a tremendous impact to the cancer physicians, researchers here, because a lot of times they are coming to the leadership team with quick requests around support for their research project, or they're trying to get another patient into a clinical trial. That's something that we have done a tremendous amount of work in, getting more folks into clinical trials. Or even emergency requests for hotel stays where we need, all of a sudden the patient's care has shifted and they need to stay here in Sacramento for a much longer period. And so we need to get them into a hotel or some other long-term stay solution. And so we've seen donor dollars go to that. That's particularly relevant for our pediatric bone marrow transplants that we started doing recently. That is really providing an amazing care resource for the Northern California community, that their pediatric patients can come here for bone marrow transplants. But that requires you to be the patient to be here, and because they're pediatric patients, parents or other caregivers to be here for weeks on at an end. And Philanthropy has helped many of those parents and families be able to stay here in Sacramento while their child is getting care.
That's so cool to hear.
Yeah, and we have a great philanthropy team who works here at the Cancer Center. We all pick up a specific disease state and specialize in that disease state. We're very familiar with the physicians and researchers and care teams who work in those areas, and can help facilitate a lot of questions that folks have. And again, going back to sort of the beginning of our discussion, it does not matter to us whether you are giving us $10 or $1 million. What's important to us is that we are providing you the avenue and space to partner with the Cancer Center in making an impact on cancer care in this community.
You touch every facet, from education and prevention to screening and research, and then the treatment and care, and even the things that we don't think about, like I have to stay over, or how do I get to my appointment, especially if I live far away. So you definitely touch every aspect of what a patient may encounter, even if they don't have cancer, through the prevention and the screening aspect of that, just to get the education and the access to them, like with our mobile Mammo Plus van. Well, Reese, is there anything else that we didn't talk about that you think is important, or that you want to hit up on?
No, I think the last statement that I'll say is, for those of you who are listening who've made a gift to the Cancer Center or made a gift to UC Davis Health, thank you so much. We really appreciate it. I hope you've listened to this podcast and heard a little bit about the impact that your gifts have had and some of the areas that your gifts have gone to. If you have questions about your gift, please reach out to me and my team. You can find us on the Cancer Center website. Talk to any of the members of the care team that you interact with. They'll get you over to us as well. But we really appreciate every single gift that comes through the doors of the Cancer Center. It makes a huge impact, and the care teams here really value that community partnership, because it reminds them that they are not the only ones in the clinic room providing care and getting through the day and working through what is an increasingly complex healthcare marketplace. They know that they have the partnership of all these donors out there in the world who are backing them up and supporting them.
Well, thank you, Reese, for your time, for this discussion, for educating me and us on this. It's been awesome. Thank you, everybody, for listening today. If you'd like to get in touch with us, you can email us directly at beatcancer@ucdavis.edu. Beat Cancer is a production of the UC Davis Comprehensive Cancer Center. For more information on our NCI-designated Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer.